Our planet is changing. Temperatures soar, storms rage, ice caps melt at an alarming rate. These are not just environmental issues, they are health crises. Climate change is the biggest health threat facing humanity. Millions already suffer. We must act now. Heat doesn't just cause discomfort, it can be deadly. As temperatures rise, our bodies struggle to cope. Heat exhaustion sets in, leading to dizziness, nausea, and fainting. Left untreated, heat exhaustion can escalate to heat stroke. Heat stroke is a medical emergency. The body's temperature regulation system fails. This can result in organ damage, brain damage, and even death. Older adults, young children, and those with pre-existing health conditions are particularly vulnerable. Cities bear the brunt of extreme heat. Concrete and asphalt absorb and radiate heat, creating urban heat islands. In these urban heat islands, temperatures can be significantly higher than in surrounding areas. This puts a strain on healthcare systems and increases the risk of heat-related illnesses. In 2003, a deadly heat wave swept across Europe, killing an estimated 70,000 people. Many of the victims were elderly and lived alone, highlighting the deadly combination of extreme heat and social isolation. This event was a wake-up call to the deadly impact of extreme heat. Climate change is inextricably linked to air pollution. Rising temperatures exacerbate ground-level ozone, a key component of smog. Wildfires, made more frequent and intense by climate change, release massive amounts of smoke and particulate matter into the atmosphere. These pollutants have a devastating impact on our respiratory health. Fine particulate matter can penetrate deep into our lungs, causing inflammation and damage. This can lead to a range of respiratory illnesses, including asthma, bronchitis, and lung cancer. Children are particularly vulnerable to the effects of air pollution. Their lungs are still developing, and they breathe at a faster rate than adults, increasing their exposure to harmful pollutants. Air pollution can lead to reduced lung function, increased risk of asthma attacks, and respiratory infections in children. The World Health Organization estimates that air pollution contributes to 7 million premature deaths each year. This makes air pollution one of the leading environmental health risks worldwide. Reducing greenhouse gas emissions and transitioning to cleaner sources of energy are crucial steps in mitigating the impacts of air pollution. Climate change is altering the transmission patterns of infectious diseases. Rising temperatures and changes in precipitation create ideal breeding grounds for disease-carrying insects, such as mosquitoes and ticks. As these vectors expand their ranges, so too do the diseases they carry. Malaria, dengue fever, Zika virus, Lyme disease. These are just a few examples of the infectious diseases on the rise due to climate change. These diseases can cause a range of debilitating symptoms, from high fever and joint pain to life-threatening complications. Warmer temperatures also increase the risk of waterborne diseases such as cholera and typhoid fever. Extreme weather events such as floods and hurricanes can contaminate water supplies and disrupt sanitation systems, leading to outbreaks. The health impacts of climate change are not evenly distributed. Vulnerable populations in low-income countries, particularly those in tropical and subtropical regions, bear a disproportionate burden of climate-sensitive diseases. These communities often lack the resources to adapt to the changing health risks. Section 5, a gathering storm, food security and malnutrition. Climate change poses a significant threat to global food security. Rising temperatures, changes in rainfall patterns, and extreme weather events can disrupt crop yields and threaten livestock production. This can lead to food shortages, price spikes, and an increased risk of malnutrition. Malnutrition in all its forms has devastating consequences for human health. Children are particularly vulnerable as malnutrition can stunt growth, impair cognitive development, and increase susceptibility to disease. Climate change can also impact the nutritional content of food. Studies have shown that elevated levels of carbon dioxide in the atmosphere can reduce the levels of protein, iron, and zinc in staple crops such as wheat, rice, and soybeans. Addressing climate change is essential for ensuring global food security and improving nutrition. This includes investing in climate-resilient agriculture, reducing food waste, and promoting sustainable diets. The mental health impacts of climate change are often overlooked, but they are no less real or debilitating. Extreme weather events such as hurricanes, floods, and wildfires can cause trauma, displacement, and loss of livelihood. These experiences can lead to a range of mental health issues, including post-traumatic stress disorder, anxiety, depression, and substance abuse. The chronic stress of living with the uncertainty and disruption of a changing climate can also take a toll on mental well-being. Indigenous communities who have a deep connection to the land are particularly vulnerable to the mental health impacts of climate change. The loss of traditional territories, cultural sites, and ways of life can lead to a sense of grief, loss, and cultural identity. Addressing the mental health impacts of climate change requires a holistic approach that integrates mental health support into disaster preparedness and response efforts. It also involves building community resilience and providing access to mental health services for those affected by climate change. Climate change exacerbates existing health inequalities. Vulnerable communities such as low-income communities, communities of color, indigenous communities, and people with disabilities are disproportionately affected by the health impacts of climate change. These communities often live in areas that are more exposed to climate hazards such as coastal areas, floodplains, and urban heat islands. They may also have limited access to healthcare, healthy food, and other resources that can help them cope with the health impacts of climate change. For example, low-income communities may struggle to afford air conditioning during extreme heat events, putting them at increased risk of heat-related illnesses. Indigenous communities may face challenges accessing traditional foods and medicines due to climate change impacts on ecosystems. Addressing health equity is essential for building resilience to climate change. This includes investing in community-based adaptation strategies, strengthening healthcare systems in vulnerable communities, and addressing the root causes of health disparities. The health of our planet and the health of our people are inextricably linked. Addressing climate change is not just an environmental imperative, it is a public health priority. The time for action is now. We need a global, coordinated effort to reduce greenhouse gas emissions, transition to cleaner sources of energy, and build resilience to the unavoidable impacts of climate change. This requires collaboration across all levels of government, the private sector, civil society, and individuals. We can all play a role in mitigating climate change and protecting public health. This includes making sustainable choices in our daily lives, advocating for policy changes, and supporting organizations working on climate action. The challenges ahead are great, but so too is our capacity for innovation, compassion, and collective action. By working together, we can create a healthier, more sustainable future for all. While the challenges posed by climate change are daunting, there is still reason for hope. Around the world, communities, governments, and innovators are stepping up to address the health impacts of a changing climate. From developing early warning systems for heat waves to creating climate-resilient healthcare facilities, from promoting sustainable agriculture practices to investing in renewable energy sources, solutions are emerging. Technological advancements are playing a crucial role. Renewable energy sources, such as solar and wind power, are becoming increasingly affordable and accessible, providing clean energy alternatives. Green infrastructure initiatives such as urban green spaces and cool roofs are helping to mitigate the urban heat island effect. Ultimately, the greatest reason for hope lies in our collective will to act. As awareness of the interconnectedness of climate change and human health grows, so too does the global movement for change. By harnessing the power of innovation, collaboration, and a shared commitment to a healthier future, we can overcome this challenge and create a world where both people and the planet can thrive.